Namaste,
Namaste.
Doctor. Doctor, if there is any relation between the change in atmosphere with the hyperactivity?
Yeah, of course, because we are part of universe. Hmm? So Ayurveda always say that you are in relation with the nature. So whatever the changes that you expect in the atmosphere will have impact on us, but we are not knowing that. But we have in the previous video we have told that all the atmospheric changes these animals can get it before we know, because before tsunami and all we have heard that all the cows are very much violent. They have run because they know that something is going to happen, so they are having some intuition, whatever we can say. But as human beings we don't, we are having more logical thoughts, we are behind little bit of intuitive power. But when we come to the kids, as their logical thoughts are less, their intuition is more. So what presently that we see is almost in this whenever there is high tide, there will be fluctuation in the mind. Fluctuation means even for adults, the decision making, the impact on what we do, our thoughts, everything will be fluctuating during this high tide. Our Acharya said that this high tide is having a relation with, or relation, when is the high tide happen? High tide is happening whenever there is a full moon or there is a black moon, Amavasi or Paurnami. So usually in the previous days during Amavasi or Paurnami, everyone will be alert. They will be doing more of ritual things, chantings will be there, many will be doing fasting. The Ekadashi, everything comes in relation with this Amavasi and Paurnami. They have made it into a ritual and it is a religious practice. But if we keep aside that religious practice, when we come to the scientific matter, in that time there will be more high tide will be there, so that impact in the mind. So physically what we see is almost every kid which is having autism or hyperactivity, ADHD, they will have this fluctuated mind 2 or 3 days before or after this Amavasi and Paurnami. Last week an incident happened. A kid, they are coming for the first time, they had this fluctuation. Our medicine started, but during Amavasi Paurnami it was little more, the hyperactivity was more. So they were little bit confused what happened. So immediately they have gone for a psychiatrist and took some medicine. But after that it again got worsened. That is secondary thing. What I say is, if anything happened during that time, you just wait for 2 or 3 days, and if it is reducing automatically, it is better. Don't take any medicine for hyperactivity. Only thing, in diet wise you should control the metabolic activity. In the sense, you can give some light food during those time. You can take uncooked or raw vegetables, fruits little more in that time. Drink enough water at that time. Usually we used to say you should drink 100 ml of water every 30 minutes, every half an hour. So automatically your cleansing or lymphatic drainage will be corrected. The more water content will be there in the cells, because our cells are 76% of water. So intake of proper water, control the metabolic activity, be calm, do some music therapy or hear some music or something else to soothe your mind, so that this fluctuation of mind during this full moon and black moon can be arrested. And little more, if you are ritualistic, you can just go to temple, church or mosque, wherever you feel that you get the calmness, or even do some yoga, pranayam. What I say is, not only for the kid, even for the parents, that time the fluctuation happens in the mind. Their decision taking at that time will not be perfect. So they also should be focused to take a better decision. Otherwise, there will be fluctuation in the kid also. Immediately you will be taking some hyperactivity medicine, that will end up in much more trouble. So first of all, parents should be focused during Amavasi or Paurnami, full moon or black moon. Then kid will be little more focused. Namaste.